Can NSAIDs worsen diverticulitis or diverticular conditions? Imagine taking a medication to ease your pain and instead making your condition worse. That's what can happen with non-steroidal anti-inflammatory drugs, or NSAIDs, if you have diverticulitis or diverticular disease. These drugs include common over-the-counter options like Ibuprofen and Naproxen, as well as prescription medications like celecoxib. While they are effective for reducing pain and inflammation, they can also pose risks for people with diverticular conditions. Research shows that regular use of NSAIDs can increase the risk of developing diverticulitis, which is inflammation of small pouches called diverticula in the colon wall. These pouches can become inflamed or infected, leading to symptoms like abdominal pain, fever, and changes in bowel habits. NSAIDs can interfere with the protective lining of the gastrointestinal tract, making it easier for inflammation, bleeding, or even perforation to occur in these diverticula. Studies indicate that NSAID use raises the risk of diverticulitis by about 1.7 times compared to those who do not take these drugs regularly. The risk is even higher for complications like bleeding or abscess formation. Non-aspirin NSAIDs, such as Ibuprofen, Naproxen, and celecoxib, are associated with a greater likelihood of these serious issues than aspirin, which is often used in low doses for heart health. The reason behind this increased risk is that NSAIDs can cause damage to the lining of the gastrointestinal tract, leading to inflammation and bleeding in the diverticula. This makes the condition worse and can lead to more severe complications. Because of these risks, healthcare providers generally advise avoiding NSAIDs if you have a history of diverticulitis or diverticular disease, unless absolutely necessary. If you need pain relief, safer options include acetaminophen or other medications recommended by your doctor. Always talk to a healthcare professional before starting or stopping any medication, especially if you have diverticular disease. They can help you find the best way to manage your symptoms without increasing your risk of complications. In summary, NSAIDs can indeed worsen diverticulitis and diverticular conditions by increasing inflammation, bleeding, and the chance of serious complications. If you have diverticular disease, it's important to discuss pain management options with your doctor and avoid NSAIDs unless they are specifically prescribed and monitored. Your health and safety come first, and personalized medical advice is always the best course of action.